I am very concerned that at the moment there aren't the safeguards and there's no need for this bill. At the moment people are protected by the law as it currently stands. People will be put under undue pressure, and obviously as a psychiatric nurse I am concerned that this current bill does not include a psychiatrist for the mental capacity assessment, which is something that should happen, and the term less than 6 months to live, as any doctor will tell you, is a very arbitrary thing. It's something that can't be clearly defined. We know many anecdotes and many stories of people who have been told that they have a certain amount of time to live and they've gone on to live much longer than that, and those original diagnoses have been wrong. I obviously understand that people want to relieve pain and they want to relieve the suffering that people experience when they have chronic long-term conditions or if they have a diagnosed condition. The issue is though that we need better funding for palliative care, we need better support as doctors and nurses, as healthcare professionals, carers and families and patients themselves need better support. Under the current funding crisis in the NHS and under the current kind of situation that we have with the government, yes, it may seem like we are providing consumer choice, but actually what we're doing is we're putting undue pressure on people who are very vulnerable and actually need more support, not less. I think we need to let people know, I think we need to let the government know that healthcare professionals, and of course there are many that couldn't be here today because they're working, as it happened I had a day off, but there are many people who, you know, and it's mainly the healthcare professionals who are involved in end-of-life care, you know, who know the very reality of it, who are opposed to this, and we need to speak for people who maybe aren't able to speak for themselves or people who aren't able to be here. And I just want to be able to say that I made a stand, I tried to make my voice heard, that I have great concerns about this and I don't want this bill to be passed.